Are you experiencing symptoms of a bacterial infection? It's important to know about the different types of antibiotics available to treat such infections. Let's take a look at some common antibiotics, their types, uses, and dose details. First, we have the penicillins. These are beta-lactam antibiotics, used to treat a variety of bacterial infections like strep throat and pneumonia. Examples include amoxicillin, which is typically taken in doses of 250-500 ml 3 times a day, and penicillin VK taken in doses of 250-500 ml 2 to 3 times a day. Next up are the cephalosporins, also beta-lactam antibiotics. They are effective against bacterial infections of the skin, urinary tract, and respiratory system. Cephalexin is one example, usually taken in doses of 250-500 ml 2 to 3 times a day. Another is Ceftriaxone, which is taken in higher doses of 1 to 2 g once a day. Moving on to the macrolides, these antibiotics inhibit protein synthesis and are used to treat respiratory, skin, and soft tissue bacterial infections. Azithromycin is a common example, usually taken once a day in doses of 250-500 ml. Another is Clarithromycin, taken twice a day in the same dosage range. Fluoroquinolones are a type of antibiotic that inhibit DNA replication. They are effective against bacterial infections of the urinary tract, respiratory system, and skin. Ciprofloxacin is taken twice a day in doses of 250-500 bar, while Levofloxacin is taken once a day in the same dosage range. In severe and life-threatening bacterial infections, Aminoglycosides are often used. These antibiotics also inhibit protein synthesis. Gentamicin is taken once a day in doses of 3 to 5 ml, and Tobramycin is taken in the same manner. Tetracyclines, another group of protein synthesis inhibitors, are used to treat bacterial infections of the skin, respiratory system, and genital area. Doxycycline, taken twice a day usually, ranges from 50-100 ml in dosage. Minocycline is also taken twice a day in the same dosage range. Sulfonamides, which inhibit folate synthesis, are commonly used to treat urinary tract and skin bacterial infections. A common example is Trimethoprim-sulfamethoxazole, taken twice a day in doses, ranging from 160-800 B. Finally, we have carbapenems, which are beta-lactam antibiotics used in severe, life-threatening bacterial infections. Imipenem is typically taken 4 times a day in doses of 250-500 ml, and meropenem is taken 3 times a day in the same dosage range. It is important to note that this is not an exhaustive list of antibiotics, and dosages may vary depending on factors such as the specific infection, patient age, weight, and renal function. Always consult a healthcare professional for proper diagnosis and treatment. Don't hesitate to seek medical advice when needed.